Hi, this is Dr. Reddy from Empower Psychiatry and Sleep. How is folic acid involved in psychiatric health or mental health? Folic acid is a type of vitamin B that is crucial for central nervous system or brain health. It is involved in folate cycle, or otherwise more specifically called as one carbon metabolism pathway. This pathway is crucial for not only neurotransmitter synthesis such as serotonin, dopamine, norepinephrine, but also DNA methylation and regulation of homocysteine levels. In this pathway, folate is initially converted to active form called as 5-methyl tetrahydrofolate, and this in turn is required for remethylation of homocysteine to methionine. Methionine is subsequently converted to S-adenosylmethionine or SAMe, which is a methyl donor for synthesis of neurotransmitters such as serotonin, dopamine, and norepinephrine. Therefore, abnormalities in this particular one carbon metabolism pathway leads to disturbances in synthesis of these important neurotransmitters such as serotonin, dopamine, norepinephrine, as well as increased homocysteine levels. As you know, serotonin, dopamine, and norepinephrine are highly relevant in depression. Further, increased homocysteine levels seems to be neurotoxic in general, as well as seem to increase risk of depression in turn. It is likely that one could get low folate because of deficiency in their diets, or because there is some abnormality in conversion of folate to its active metabolite or 5-methyl tetrahydrofolate. Most importantly, an enzyme that is required to convert folate to 5-methyl tetrahydrofolate is methylene tetrahydrofolate reductase enzyme. This in turn is regulated by methylene tetrahydrofolate gene or MTHFR gene. Abnormalities in MTHFR gene or MTHFR gene polymorphism in turn can lead to disturbances or difficulty in terms of conversion of folate to this active metabolite 5-methyl tetrahydrofolate. Most importantly, in US, 10 to 15% of population seem to have abnormalities in MTHFR gene, or otherwise known as MTHFR polymorphism. Now, this seems to vary depending upon Caucasians versus Hispanics, where it seems to be much more prevalent in the range of 25%. Asians seems to have in the range of 10 to 15%. African Americans, on the other hand, seems to have lesser chances of MTHFR gene polymorphism in the range of 1 to maybe 5%. However, in individuals with depression, the MTHFR gene polymorphism seems to be much higher in the range of 35 to almost 45 to 50%. Thus, if you have an individual who has depression, it is almost 35 to 50% chances that this person could have abnormalities in conversion of folate to 5-methyl tetrahydrofolate, the active form of folate. Furthermore, it has been found that individuals who have deficiency in folate or abnormalities in this particular cycle does increase risk of depression. Keeping this in context, supplementation using the active form or L-methyl folate seem to increase chances of improvement in depression. To add to this particular aspect, there have been several studies which looked at supplementation with L-methyl folate in individuals whose depression is not improving with one medication or one antidepressant. There are also studies which looked at just using L-methyl folate as a supplement in order to see if that would improve depression, and several of these studies had positive results. Keeping all this information in context, if you have an individual who is struggling with depression despite trying 1 or 2 antidepressants at appropriate dosage for appropriate length of time, folic acid should be kept in mind. From the context, more specifically, it is likely that disturbances in this aspect or folate metabolism could be playing a role, and thus L-methylfolate supplement might be useful in increasing the chances of response in such an individual. Most often, a common supplement that seems to improve chances in terms of increased response rate is L-methylfolate. There are few studies which looked at the dosage of L-methylfolate in such case, and 15 milligram L-methylfolate seemed to have more significant benefit than a lower dose of L-methylfolate supplement. To summarize all this, folate metabolism plays a crucial role in central nervous system or brain health or psychiatric health. 10 to 15% of US population seems to have genetic polymorphism of MTHFR gene. This may be more so if somebody is Hispanic. Also, almost 35 to 50% of individuals with depression likely could have abnormalities in folate metabolism due to MTHFR gene polymorphism. Keeping all this in context, if you have an individual with depression whose depression is not improving despite 1 or 2 antidepressant medication trials, supplementation with L-methylfolate 15 milligrams could be useful in increasing the chances of response. Thank you very much. This is Dr. Singarvedi from Empower Psychiatry and Sleep.